Değerli katılımcılar, tekrardan hoş geldiniz. Günün diğer bir paneli, bir mülakat görüşme için söyleşi olacak. Moderatör olarak Profesör Doktor Taşlı Kurt Hocam'ı kürsüye davet ediyorum. Buyurun hocam.
Değerli katılımcılar, şimdi bir konuğumuz var Amerika'dan. Amerika'daki sağlık yönetim sisteminin eğitimini anlatacak. Sunum olacak 10-15 dakika, sonra soru cevap yapabiliriz. Ama İngilizce olacak. İngilizce sunacak. Çok kısaca özetleyebilirim sonunda çünkü zamanla ilgili problemimiz olduğu için. Şimdi müsaadenizle kendisine açıyorum. Dear participant, dear colleagues, dear faculty member and practitioner, welcome to our session. Now we are talking about, we are going to listen USA healthcare management education system, employee system. So we have a guest, we have a keynote speaker from America, Professor Dr. Maldonado. Please come here and you will present.
Thank you so much, Professor Tashton. Yes, hello everyone. Thank you for coming this afternoon. And it's a pleasure for me to be here at University of Alabama at Birmingham. And you may be wondering, where is Alabama, right? So I'm going to show you a map, okay? And here is Alabama, Florida, Georgia, Alabama. So right in the middle, it's Birmingham. And I come from, like I said, University of Alabama at Birmingham, or UAB. And this is kind of some pictures of the university. It's a pretty large campus. It has medical school, it has all different types of programs. Our particular program is in the School of Health Professions. Okay, and so in the U.S., you know, the programs compete based on the rankings, the U.S. News, and we are actually the #1 right now in terms of healthcare management programs, and so we're very excited about being on the top of the list. It took a while; it took some years to get there, but this is a picture of my department. Okay. Of my colleagues. It's a pretty large department. It's about 40 faculty and staff. Okay, and we have people from China, from India, from Turkey, from different countries, and Israel. So it's a pretty diverse group. Now, before I talk to you a little bit about the education in the U.S. and healthcare management, it's important for you to understand a little bit the complexity, right, of the healthcare system. And you can see here that we have both public financing, in terms of where the funding is coming, public financing, private financing, and down here are the providers, right? Hospitals, physician, long-term care, mental health. So this is showing the flow of money. So as you can see, the federal government, state government, local government, then you have all the people that are privately insured, particularly through employers, but also now through what people call Obamacare, okay, marketplaces. So Centers for Medicare and Medicaid Services is the largest federal agency. I guess it would be somewhat parallel to Social Security, right? You said in Turkey, right? But they administer the large public programs. Medicare is for older adults. Okay, Medicaid is for low income. CHIP is for children. So as you can see, our system is very complex, right? So the students have to really be able to understand the system and how to best optimize care in that type of system. So Ismail was asking me today about what were some of the current U.S. healthcare policy issues, right? And similar to Turkey and everywhere else, right? We have the problem of nursing and primary care physician shortages. We're shifting from what was called fee-for-service to value-based reimbursement. We want to pay more for quality, not just for providing services. We also want to pay for quality. We are trying to integrate care better by using bundle payments, accountable care organizations. It's a way of integrating across the continuum of care. Okay. The other big development in the U.S. right now is looking at population health and the social determinants of health, because medical care is only a small component of what affects healthcare, right? There's what happens at home, what happens in the community. So healthcare organizations now are trying to take that into account when they are trying to manage care. Diversity, equity, and inclusion is a big topic, particularly addressing health disparities, whether it's between racial ethnic groups or low-income rural populations, all of those things that result in health disparities. We have problems with increasing healthcare costs, particularly in the government programs, and I'm sure that's, the same thing in Turkey. And if you read the news right now in the U.S., it's about the debt limit, right, and expanding the debt limit. And part of that is relating to these costs. Now, the Republicans like to focus on Medicaid, because Medicaid is for low-income people. They don't like to touch Medicare, which is for older people, because the older people vote and will get them out of power. So that's the reality, right? Prescription drug prices is a big issue. As you know, the U.S. has the highest prescription drug prices, and mental health and drug addiction. A lot of people die every year from fentanyl and a lot of these different drugs. Okay. So talking specifically about the healthcare education, we have a Commission on Accreditation of Healthcare Management Education, CAMI. I don't know, Professor Tashkent, do you have a similar accreditation? Kind of similar, right? So this is the accreditation for our healthcare management programs. They basically are a not-for-profit organization, and they establish criteria that our programs have to meet. They also come and visit the department. They are there for a few days, and based on how we show that we perform, they accredit us or tell us that we have to go through the accreditation process again. One of the things that they emphasize is competencies, okay, having some type of competency model. I'm going to show you here an example of our competency model. And as you can see here, there in our UAB, we have three major domains: leadership, knowledge of the healthcare environment, business, and analytical skills. And then within each of these, we have different competencies that the students have to meet. So what do? We map the courses that we have in the curriculum. We map them to make sure that they are covering this type of competency, okay? And like I mentioned, this is kind of something we are emphasizing nowadays. Social determinants of health, health inequities has been added. Of course, the health information technology quality and performance. So this is just, UAB, but other universities kind of follow a similar model. They can determine which specific competencies they want to meet, but it's around the same idea. Okay. One thing that we do in the U.S., and actually UAB kind of started we have case competitions, and I don't know if you have that in Turkey, but basically universities form groups, teams of students, okay? And they come, we have like, at UAB, we have like in the month of February, 40 programs came to our campus to compete. They are given a real life problem, and they have to come up with a solution and present it to a group of judges. And these judges are people that work in the field. And there are other ones similar UCLA has, and also other universities. We were one of the first ones that started this, but it's a great way of having students kind of develop, be innovative, think about solutions to current problems. And also it's a great way for them to network, okay, to come to UAB and network with other students. This is, for example, in 2022, University of Minnesota, the team from University of Minnesota won, and they got also a prize, $12,000, that goes to the university to kind of help their program. This is just to give you an example of the types of programs that we have in the department. And as you can see, we have two types of doctorate, the traditional PhD, okay? But then we have also an executive doctor of science in healthcare leadership. So people that are in the field, they may be clinicians, they may be people that have a lot of administrative experience, but and usually they already have a master's, so they want to do a doctorate, but they don't want to be a PhD because they don't want to be a poor student. So they can work in this program, which is more of a hybrid program. They come to campus every quarter for a few days, and then they work online. So as you can see in the master level, we have the traditional health administration programs, both residential executives. Then we have health informatics, healthcare quality and safety, and healthcare simulation. These two programs are new that we started recently. And then we have an undergrad program in healthcare management, and then we have a lot of certificate programs. These are just two examples, including one in mixed methods research. Most programs offer in hybrid format. The Master Health Administration Residential is strictly in person, because in that program we want students to be on campus, to be able to train them, nurture them, and that program is what gives us to be #1 in the country because of the performance of that particular degree. Okay. One thing that students complete, remember a lot of the residential full-time master students, a lot of them come directly from an undergrad program. They haven't had necessarily work experience. So one thing that we require is after completing the 2-year full-time work, they do a residency program. And that gives them an opportunity to actually apply what they learn in a healthcare setting and also earn money. The wages are going to be lower than in if they went into an administrative position, but it is a great way of them getting experience. And also most of the places where they get hired as a resident, they stay working at that institution. One thing that we do a preceptors conference where we basically bring a lot of different healthcare organizations, administrators. They come to UAB, they meet with students. There's about 40 to 45 organizations. We have a computer system that kind of matches preceptors, which are the healthcare executives that come with students for interviews. So it's a very effective way of matching students with preceptors or the mentors that will be working with them in the residency program. So this is about a 1 year, and then they can graduate from the master's once they complete that 1 year. Now, this is only residential. The executive students already have experience, so they don't have to have a residency program. So these are some of the jobs that our residents can get. You know, as you can imagine, in the U.S., we have a variety of different organizations, so they can go into directly management, whether it's hospital management, long-term care facilities, or even a clinic. Can be a health information manager. That, of course, would be more if they have a health informatics degree. They can get into consulting. They can become a quality improvement specialist, especially now that we have that patient and safety master's degree. They can become a practice administrator for physician practices. Usually in the US, you have large group practices of physicians, so they can become an administrator. And then they can also be program managers for very specific areas, disease management programs, patient education, you know, a lot of very focused, tailored programs that they can also get into. And then, of course, if they're interested more in marketing, finance, you know, they can get into those functional areas and specialize in those areas. So this is my last slide. There is, you know, over 400,000 people employed in the U.S. in health care management and related professions. And it's going to keep growing. It's expected to be growing 32% because of the aging of the population, right? And increasing as the population ages, there's going to be increasing demand for healthcare services. And we're already seeing a decrease in the number of people going into college, okay? Because, you know, the younger population is less as we are going through time. So that's in a nutshell to give you an overview of, from my perspective, about healthcare management, education, and employment in the U.S. Thank you very much.
Professor Maldonado, thank you so much for your inspiring presentation. Very important. We learned your system, your education system. Let me a little bit briefly explanation in Turkish.
Sure, absolutely. I can speak here.
Değerli arkadaşlar, Profesör Maldonado bize Amerika'daki kendi üniversitesini ve Amerika'nın azıcık sağlık sistemine değindi. Gördüğünüz gibi özel sigortalar orada daha çok. Yapı bizden farklı. Obama sağlık sistemi, Medicare sistemi ve oradaki yapıyı anlattı. Daha sonra da kendi üniversitesindeki sağlık yönetimi sisteminin akreditasyon üzerinden yürüdüğünü ve sağlık yönetimi becerilerinin tanımlandığını ve buna göre öğrenci yetiştirdiklerini, çok dinamik, farklı başlıklar altında mezunlar verdiklerini, mesela sertifika programları olduğunu, doktorada iki yönlü olduğunu, hem teorik bir üniversitede akademisyen için doktora mezunu yetiştirdiklerini hem de sahada çalışacak doktora mezunu yetiştirdiklerini, yüksek lisans döneminde de yine farklı kalite geliştiricisi, proje yöneticisi, program yöneticisi, hasta güvenliği üzerine çalışan, yani böyle konular, alanlar belirleyip bu alanda mezunlar verdiklerinden bahsetti. Ve Amerika'da son işte 2022 yılında 422 bin civarında hastanelerin sağlık sisteminin yönetim pozisyonlarında istihdam sağlandığını ve giderek özellikle yaşlılığın artmasından dolayı da bu sağlığa olan talebin artmasından dolayı da bu alandaki istihdamın sürekli arttığından bahsetti. Özetleyerek bu şekilde sağlık yönetimi, eğitimini ve istihdam alanlarından bize bahsetmiş oldu. Şimdi sizler tarafından soru varsa merak ettiğiniz, hem sağlık yönetimi, eğitimiyle alakalı hem de Amerika'daki sağlık sistemiyle ilgili ben nacizane kendisine çevirerek sormaya çalışacağım. Ya da doğrudan İngilizce sorabilirsiniz eğer şeyiniz varsa. Evet, İsmail Hocam.
Dear Professor, thank you very much for the presentation. Yeah, thank you very much for your presentation. I'm curious about the ratio of people applying for your master's and other postgraduate programs, apart from the healthcare administration bachelor programs, for example, nurses.
I'm sorry, Ismail, I can barely hear you. Can you speak a little bit louder?
I'm curious about the ratio of people applying for your master's and PhD programs, apart from the healthcare management bachelor programs, nurses or other physical therapists, dietitians. What is the ratio? Can you say about this?
Yeah, that's a good question. In terms of, and I think particularly because our program right now is #1 in the country, we get a lot of applications for the Masters in Health Administration residential program. So we select only 20-25 students. We want to keep the class small, relatively small, because we want to work on a one-to-one basis with them. We go through a process where we not only look at their grades and exam, we also interview them. The other thing is that we also want to have a diverse class, gender, race, and all that. So we take a lot of things in consideration to have a group that is very strong. And so, yeah, it's very competitive. For other programs, it's not as competitive. Undergrad programs, it's because it's a large program, we have more spots that we can fill. The PhD program is also fairly competitive as well. We get people from different countries applying for the PhD program. So it depends on the program. Some programs, again, the Master in Health Administration residential is the one with the most applications. The other programs, not as much.
Very much.
Mhm.
Do you have any more questions? Ben de bu arada sorayım. Bizim Türkiye'de akreditasyon zorunlu değil. Yani bazı bölümler akredite oluyorlar. Atanırken de bunun bir farkı yok. Acaba Amerika'da akreditasyon zorunlu mu değil mi? Onu sormak isterim. Your accreditation program is compulsory or selective? In Turkey, selective, not any compulsory rule.
Oh, yes. It is the accreditation process is not, it's voluntary. It's voluntary. But in order to be in the rankings of the US News, which is what students are looking for, you have to be accredited. In most universities, they like their programs to be accredited. So I would say most healthcare management programs are accredited, unless they're in a business school and they don't see necessarily that they need it.
They give you any positive advantage for looking for a job or not? The accredited
It
program.
does. It
Doesn't.
does. Yes, because the network of universities, that are accredited is a very strong network. So they can use it in order to help place students, in other geographic areas, so it is a very important aspect. Mhm.
Bunlarda da zorunlu değilmiş ama olan akredite programlar çoğu olduğu için bayağı avantajlar sağladığını söyleyeyim. Teşekkür ederim. Yes.
Thank you, Professor. In logistic program in Turkey, we gave some case study on real problems for logistic programs. We give students, and they have a limited time, and they solve and for competition. And we give after that this competition, we give some gift as money.
Sure.
This competition every university, and they from every university the students join this program, and they compete with other students. And Other the program, final the program, the winner students, we give money and thank you won in this program. Said, but in healthcare programs there is not a similar program. I think it's lack of yani
Yes, these are type of opportunities. Yeah.
I think it's very good example for us. And my question is on this internship program work for PhD or master students. We give some for master students or PhD students. We give some homework. We say that please do it and give certainly I will put this homework and give some point. All program this process is similar. But your program is internship. There are internship program, and you say your students this interview this actual management and say and give some information about their real drive and experience. I respect your presentation, this meeting. But in Turkey, there isn't any problem for your program, similar your program. And I think how do you agree with this organization or this healthcare managers? I think is it hard because it will take the people who have managed don't close you. Go and don't nasıl başarıyorsun nasıl? Yeah. This process.
Yeah, those are good questions. And now you mentioned about the case competition, and it's kind of interesting because UAB, my university, was one of the first ones that started doing it. Now there's like 10 different universities because they see the value of that, the name recognition and all that, and the networking, and what we do is we give them a case study 1 week before they come to UAB to work on the case study. So it has very limited time for them to prepare, and they don't know anything about the case study until that week before. Okay. Now, with regard to the residency, it's a little bit different in the sense that we actually place the student to work in a healthcare organization. Like I said, we get like 40 to 45 healthcare organizations coming. They want our students. Part of it is because we have a very strong alumni network. Okay, so in those alumni, they want to recruit other students that are graduating from UAB. So that's usually very important, is to have strong alumni linkages that you can bring the students. Good questions. Thank you.
Thank you so much your contribution. We appreciated your time, effort, everything. I hope we welcome you again at the other conference. Evet, Profesör Maldonado konuşmasını yaptı. Sorun mu vardı hocam? Tabii. Said that you, thanks to you.
Katılmaktayım. Astrolog Profesör Mukaddes Örs. Sorum şudur, sertifika programları olduğundan bahsettiler.
Evet.
Sertifika programında herhangi bir kredi var mı? Varsa kaç kredi üzerinden bu program tamamlanmakta? Sorum budur benim.
Hı hı.
Teşekkür ediyorum.
Associate Professor from Antalya University. Curious about your certificate program. Is there any credit contribution to the diploma program? There is any combination of it?
Yeah, so we have been very creative about that. So we have, for example, we have a master's in health informatics, but not everyone can complete a master's or have the time. But there may be professionals that would want a certificate. So it usually would be like 12, 15 credits. So we don't create a new program. They just take the same courses that the students in the masters are taking, but it's a lower number of courses, and we create a certificate that way. For health professionals that are not ready to do a master's, but want to have that certification in their resume. Thank you so much. Ismail, yes. Can you see them online? Yeah, let me check on that, Ismail, to see if we have, oh, you mean like in the future? If you can, there may be. Yeah, let me check on that. Yeah, absolutely. Let me check on that. I'll let you know. Absolutely. Thank you very much for the opportunity.
Thank you. It's time to give you some certificate.
Thank you. Sayın hocalarım, katılımınız için teşekkür ederim. Oturum başkanınıza buyurun hocam.
Aha.
Bir şey söyleyecek.
Sertifikadan sonra küçücük bir törenimiz daha olacak. Bir sertifika töreni daha. Dolayısıyla bir 5 dakikanızı da almak isteriz. Fakat
Tamam.
öncelikle hocamıza şeyini verelim, belgesini.
Hocamıza katılım belgesi ve plaketini vermek üzere doçent doktor İsmail Şimşir hocamı sahneye davet ediyorum.